For our healthcare executives out there that are listeners, it would be so great to meet you in person. And that opportunity is coming up in June at our 13th annual Healthcare Executive Forum. It is being held in Madison, Wisconsin. It is the afternoon of June 18th and the morning of June 19th. This year, the topic is how to make high reliability, psychological safety, and just culture simple. And not just make it simple, make it happen. Because what we're known for at Capstone Leadership Solutions is taking big, complex ideas and helping them become practical, doable, and actionable ideas that get positive impact. You can sign up using the link below in the show notes, or you can email us at info@capstoneleadership.net. It would be great to see you there.
I think also empowering staff to have the flexibility to make or have suggestions on, I don't think this is really working. Can we try it a different way? I know we're not going back, but here's how
we need a tweak.
Yeah, here's how we can manage going forward and maybe even make it better.
Welcome to Culture Change RX, the podcast for healthcare professionals that are committed to creating a thriving workplace culture, improving the experiences of employees and patients, and ultimately unlocking their organization's next level of potential. I'm Sue Tetzloff, your host and co-founder of Capstone Leadership Solutions. Join me and my insightful guests each week as we share actionable insights for navigating the crucial people side of the business of healthcare. Subscribe now for a weekly dose of Culture Change RX. Now let's dive into this week's conversation where culture change takes center stage. Welcome to another episode of Culture Change RX. Today is one of those episodes where I have the delight of having a guest in the studio. And as always, we have our guests introduce themselves to get us going, and then we're going to dive into a conversation. Today we have a theme lined up about innovation, about how sometimes innovation comes out of crisis and necessity, and sometimes that's good. So we're going to talk about the goodness of that and the application of that during our conversation today. Welcome, Jess. I'll turn it over to you.
Hi. Well, thank you for having me. I really appreciate this time today. So, my name is Jess Nuutinen. I have been a nurse for over 20 years, and I worked at the bedside. I've been in the middle management roles. I've been a CNO and a COO. And I've worked with such organizations as Mayo Clinic Health System, Health Partners out of the Twin Cities, Minneapolis, St. Paul area, down in Texas, and then in northern Wisconsin. And I look forward to being able to share some of my experiences with you.
Yeah. It's a pretty typical scenario, especially nursing. There's so many different places you can go and use that knowledge and experience and skill set. And so I just think that's one of the beautiful things about nursing in particular, but healthcare in general. So yeah, lots of hats, lots of opportunities to make a difference. So, well, today let's dive into this conversation that we were prepping a little bit before our call today. We really landed on this idea of innovation and how, even taking people back to the pandemic. And sometimes it's like people go like, no, don't make me go there, right? And you were in Texas during that time and serving there. And I think that's a good starting part if you want to jump into your time in Texas and really how some of the things that you experienced there led to some important innovations and things that can benefit healthcare well beyond that time and period. So take it away.
Yep. So I'll give you a little bit of background first, a little bit about the facility that I was working at in Texas, so can kind of understand the situation and location and geographics. So the organization I was working for was in Del Rio, Texas. Del Rio, Texas is southwest Texas, about 3.5 hours straight west of San Antonio, and about 4 miles away from the Mexican border. So it was a rural hospital, licensed for about 93 beds, but very isolated from a lot of the urban areas and resources, right? And that was one of the things that drew me to taking the chief nursing officer position there. In my past lives, had worked at critical access hospitals, rural hospitals, and being in an organization that can really focus on underserved with limited resources, limited staffing, etc. So that's what brought me to Texas. And I had been in Texas only for a short while when COVID really became rampant in Texas. And most of Texas was overrun with COVID patients. And of course, our geographic location being where it was, we didn't have many resources to take care of those patients, and we could not transfer those patients anywhere to a higher level or where they needed to go. And so what we had to do was be innovative, right? Because that's our focus. How do we take care of these patients? How do, we keep them alive, basically was our focus. And so some of the innovations came from, we actually asked the military to come in, and they taught us how to make basically what I call mobile MASH units inside of our hospital. And so we flipped our ICU, our PACU, our cath lab, and our pediatrics unit into vent-supported negative pressure rooms that we could then put our COVID patients in. However, that's great, but I didn't have the nurses with the skills or the physicians and medical staff with the skills for vents and other cares that went with it, right? So we really had to do a lot of just-in-time training. Education was key, and also materials management was key because everything was short, right? We didn't have enough masks. And so we really, really counted on the military for about 2 months to help us and teach us and learn different ways of taking care of patients. Patient throughput was really important. Did the patient need to be here? How do we treat patients? What do we do with surgeries? I think the things that everybody else was doing at the same time, how do we use telehealth? How do we use different resources? And so what that did for my staff, because, innovation and a quick paced change can burn out employees, right? And there was a lot of employee burnout during that time in a lot of organizations. But I will have to say we had limited burnout. I can't say we were perfect, but giving them the tools, feeling like they can adequately take care of these patients, they were more apt to take on more shifts, And I'll tell you, we did have incentives for taking on additional shifts as well. And what I didn't mention earlier is we also had a blizzard during that time. So talk about innovation. In Texas, they're on their own grid. And so we had rolling blackouts. We had no water in the whole city during that blizzard. Materials coming in were also limited because of where we were located. So we, at that time, had 9 dialysis patients. So how do you keep those dialysis patients going, right? So we partnered with our fire department where they went and pumped from one of the local springs and they pumped into our pipes. So we had adequate PSI pressure in the pipes to keep our dialysis patients going. So being innovative, you really have to think out of the box sometimes, right? And so I think, although COVID was a traumatic time, but it was also critical for us to elevate our practice and be innovative in how we deliver care. And I believe it really kind of catapulted us into a different paradigm is probably the right word. I think that, this is the way we've always done it. This is kind of the paradigm of nursing. And I think it really turned it on its side, right? How do we look at delivering care differently to our patients in the bedside? So, after my experience in Texas, I moved back up to northern Wisconsin, where I was born and raised. And COVID did not impact the hospital that I went to the same way as it did in Southwest Texas. And so when I got to northern Wisconsin was just feeling some of the outbreak of COVID. Although not as severe, thank goodness, it was still very traumatic for those who were working in the critical access hospital in a rural area, almost in the most northern part of Wisconsin. And so, Sue, as we were talking earlier about the innovation maybe being portable, that's where it definitely was portable. I was able to take the experiences that I had in Texas and apply them and help decrease, I think, the criticalness, if that's a right term, but help decrease some of the panic and the anxiety. Now, this was a team effort. So we created a really, really nice surge plan in our emergency department that had never been there before. Now, we knew we couldn't transport vent patients up to the higher level of care, and we didn't have a lot of vent capabilities in our med surge area. So involving the staff in the actual creation of that surge plan, talk about engagement. And it really decreased the anxiety, increased engagement, and we had better outcomes because of that. How do we manage the volume of these patients in our emergency department? Telehealth as well. Then we implemented critical care on demand. So we could take care of some of those critical patients that we had never taken care of before, So I think another innovative and probably one of the most significant innovative things that Ashland did was flip their total joints that used to be a 2-3 day stay, right? And they became outpatients. So, 90% of those total joints now were outpatients. And that took the effort of the whole team, right? Medical staff and nursing and other ancillary departments. So, I'll just kind of pause from there.
Yeah, there's so much.
A breath.
Absolutely. You deserve a breath there, girl. You probably deserve a good rest after all of that, too. So, yeah. So, there's so much there going back to your time in Texas. And I know that it probably looked a little different when you went to northern Wisconsin, but this idea of not just the staff innovating on a quick pace, right, out of necessity, but I love the part about the partnerships, right? So, sometimes what really helps you get through and to manage and to figure it out isn't just what's inside, but all around you and in your community. When you talked about staff working extra shifts, yes, there were incentives, but I find that the culture in rural communities, and I don't know if you'd agree with this, but my perception has been in my own 22 years working in a community hospital is that we pull together. In crisis, we do pull together. Now, I know that there's been some other challenges to healthcare most recently, like an IV shortage and things like that. So I would assume that, once we've been through very critical and short timelines, such as during the pandemic, that maybe something like an IV shortage seems kind of, just like another day, but it's still a crisis and it still needs to be managed and it still needs to be innovated. Do you find that maybe like every challenge that's come after that gets met a little differently from healthcare workers and even yourself as a leader?
Yeah, I would agree with that. I believe the pandemic also taught us how to approach crisis is different. And to your comment about partnerships. So the IV shortage is a really good example. And depending on where you worked or what manufacturer you had, the shortage for the IVs was different, right? But for surgery, it's a crucial item. So for those organizations that were short on IV fluids, they had to be innovative. How do we still take care of these patients? So do we really need to use this solution? Can we use different tubing? How can we manage our materials differently? And that takes a group effort. Because at the end of the day, when a patient walks into your emergency department with some sort of critical issue that needs to go to surgery or needs IV fluids, you still have to take care of them. So what are alternative solutions? I'll tell you, our materials management and our supply chain was a crucial figure in our IV shortage, and procurement. But it took a team. Again, just like the pandemic, we would meet, we would talk about innovation and solutions and probably change some of the ways we use IVs now today. In fact, we had some pretty good positive outcomes managing through that because some of the manufacturers for the IV solutions just got back up and going in February. So that's a month ago. And our patients couldn't really even tell. So if you think about it that way, us as a team and having that partnership, although we probably had heartburn over it, our patients didn't know that. And I think that's a really crucial thing. If I can add one more short little example about partnerships. In a rural area, we had a really scarce resource in our paramedics. And so our paramedic service was only able to answer, I think, about 45% or less of our transfers. And so we created the first time program for RNs to actually be credentialed and on the roster for the area fire department. Now, back in the day, when I was a frontline nurse, any nurse could just hop in that ambulance, right?
I remember those days too. I was thinking the very thing, Jess.
And those days went away and haven't been
Everything
here
old
for
is new again, right?
Yeah. Well, now there's a little bit of standard work around it, right?
Yeah, there's some rules.
There's a curriculum and a training, and we were able to increase with that partnership to our transfers to be 75%.
Nice.
That's a pretty significant, and I'll tell you that staff satisfaction, especially medical staff satisfaction, and that innovation kind of springs forwards.
Mm-hmm. Yeah. Yeah. Our business, Capstone Leadership Solutions, what we help healthcare organizations do, several things, but one of the things is like kind of the thread through all of it is really to navigate change. And usually they're big changes, and many of them all at once. And so over a period of a couple of years or more. So we watch organizations go through big changes together. And I loved what you said earlier about catapulting into a new paradigm or a different paradigm and really out of necessity, like innovating out of necessity, but moving into this new way of doing something out of pure necessity because one, we have an IV shortage or we have a blizzard or we have a pandemic or whatever. And you're kind of like forced into this new way. Versus having all of the time and the thought and the space to innovate. And, one thing we can do is over plan and, over process, a change as well that like we can go on the other extreme too, where we take too much time and we never get to making that improvement in the result that we need to get sooner rather than later. But I do find that, that statement you made of this is how we do it around here. And now we have to change it quickly. And that quick pace change can be stressful for people. But I know that on the other side of that, especially crisis, there's a point where you can say that works better than what we did before. Let's keep it. That we can't wait to get rid of it and go back to the old way. There was probably some triaging there that had to go on there, or maybe some people that, wanted to go back to the old way, but it wasn't available to them anymore. So there's a lot going on there with individuals, groups of individuals, and entire organizations of individuals when you're talking about almost like the post or the future of change, whether it was required or optional or whether it was, out of necessity. So I'm wondering, can you think of any stories or examples about how humans or groups of humans adopted that new paradigm and how they felt about it and a story about that? I would love if you could search your brain.
Yeah. So, I think the outpatient surgery with the joints is probably the best example. That change happened very quickly overnight almost. And at the time it was, well, this is going to be temporary. And when the pandemic is done, we'll go back to the way we used to do it. And I do believe that we did it for so long as an outpatient, it became the norm. Right. We'll have still an overnight stay if there is a patient with some comorbidities that, warrant an overnight stay, or if they're waking up a little bit longer than from anesthesia. But it became the norm. And, we became a center of excellence for orthopedics. And as DNV is the accrediting body for that came in, they were so impressed that we were that innovative, that we didn't slide back into the old ways, and that, our staff really didn't want to go back to the old ways. And I say that in air quotes, right? Now, did we still have to look at some of our processes in order to keep that sustainable? We did. And we have to continually, we still look at our data to make sure that we are doing it correctly. That we're looking at our surgery site infection rate, because that was one of the things that we were really concerned about. This is a pretty big surgery and we're sending them home on the same day. And, are they going to
managing that wound?
I know. Or their mobility, or, and so some of how the therapy changed, we would track that data and still are tracking that data, right? And continually looking at how we can improve the processes, how we can improve the education. But I would have to say that is one of the prime examples of the original intent was this, it was going to be temporary, and then it became the norm.
Can I tell you a secret? That's some coaching and advice that I'll give when I see a real strong resistance to change. Maybe it's a local level change in an individual department or service line or process, or even a big sweeping organization-wide changes. If people are really resisting the change and it's really slowing down the possibility of the change, and it's really a must-have change and it's not really optional and we got to figure it out, but we have a little time, is I do love to offer up, let's call it a small test of change, a trial, a temporary, give it a go thing.
Mm-hmm.
And so people are willing to commit to often a trial, right? And they'll let their resistance down enough to give it a go, to give it a chance, and to see what happens. Where if they feel like it is permanent and that we're never, possibly going back to the old way if it doesn't work, then we're fighting to get a really good test of the new, better way because there's so much resistance. And so it seems like a trick, but it's one that works.
Yeah, I would agree with that. It's sometimes the words you use in order to manage the change, right? Yeah. The readiness for change. And in crisis, readiness is, you don't have time to measure that, right? And even if there is some sort of compromise or meeting in the middle with some of that change, some of it may have to go back to the old way, but here's where the majority of it is going a different way. And I think also empowering staff to have the flexibility to make or have suggestions on, I don't think this is really working. Can you try it a different way? I know we're not going back, but here's how
we need a tweak.
Yeah, here's how we can manage going forward and maybe even make it better. And I think listening to the frontline staff as you're going through that and taking their feedback and applying it, as long as we know that it is, that keeps the engagement. It reduces burnout. And then they're a part of that innovation. And what I found through some of these experiences, value in our frontline staff and the work they do and including them. That's how you actually make the change and encourage innovation. If they see that they can be a part of it, then it's exciting for them.
Yeah, absolutely. We use a term in Capstone world called the case method, copy and steal everything, but make it yours and make it better. And when you describe the example of knowing something that worked in Texas and then bringing it forward to Wisconsin, but then that surge plan, but then saying to them, this worked there, but how can we make it work here? What do you see? How can we make it work here? Then there's that ownership too of it wasn't imposed upon us. It wasn't done to us, that we have some say and ownership and can one up it. That's one thing that we challenge. Like we might take some really great best practices and share them, but really challenge the receiver to make it even better, one up it. Like take it and shine it up and make it even better. And then we'll take that off to the next person and make it even better. I think that's where really great results come from is that level of study and adjust and tweaking that just makes it even better for the next one.
Yeah, and I think it's, on the spot too. If there is, they don't have to wait and bring it through 5 different committees.
Oh, yeah. That was one of the benefits of a sense of urgency, right? Is a
Yes.
lot of the bureaucracy just had to just be stripped away. If we're going to celebrate, a positive or a silver lining, let's talk about that. Yeah, the speed and the ability to innovate quickly. Even the amount of rapid adjustments to, yeah, and you're right, there's some downsides to that with burnout and stress and communicating so many changes all at once. But look at this, 30 minutes just fly right by, don't they, Jess?
Yes, they do.
We love to talk about this stuff, and I'm sure we could talk about it for hours. But is there anything, just final thoughts or comments or tips or tricks that you wanted to make sure while we had the mic still on that you wanted to maybe add to today's conversation?
No, I just know that healthcare is rapidly changing. And I do believe that healthcare is going to keep rapidly changing and the paradigm as well.
Mm-hmm.
And we're going to have to keep up with it. And I think we're going to have to continue to be innovative in order to keep our staff engaged, recruit, the retention, and then still be able to keep our practice at an elevation that is best and growing.
You're right. Things are just going to keep changing, and there's some stressors to that, but there's some upsides for healthcare organizations and the people that work in them, and definitely on the other end, the patients too. So, which is primary. Now, Jess, you mentioned your work in Wisconsin, but I know you're up to some different things right now. I know that you joined up with some other amazing healthcare leaders that are working to improve rural healthcare at Frontier. And I'm going to put a link to Frontier in the show notes so that people can check that out. But is there anything you wanted to say about your work there or the work of Frontier?
It's a new consulting group that is being led actually by a CEO that I worked for. So very exciting. But this group consists of different disciplines. So my focus is on nursing and elevating and nursing practice. We have a quality representation. We have HR representation. We have it from a CEO perspective, from a marketing and strategy. So our group is all encompassing for going into a small rural hospital, critical access hospital, and really kind of helping them with some of those components that they may not have the bench or the depth to have a full-time person or to even have those resources. So, we are just getting started, and there is a blog. So if anybody out there wants to follow our blog, and I just did one on the importance of shared governance.
I would really encourage people to read the blog. I'll make sure that information is in the show notes. Thanks again, Jess.
Thank you, and have a good rest of your day, Sue.
Thank you. Thanks for tuning in to Culture Change RX. If you found value in today's episode and you are a believer in fostering change in healthcare, join us in making a difference. Follow, rate, and review our podcast on your favorite platform. Share it with colleagues and your network. Together, we can make a lasting impact. Until next week, keep inspiring positive change. We know that healthcare executives have their sights on high reliability, just culture, and psychological safety. In true capstone fashion, we're all about helping simplify the complex and helping entire healthcare organizations execute successfully on big, bold initiatives such as these. One such way that we can help is through our upcoming Healthcare Executive Forum. In its 13th year, this forum has been helping healthcare executives learn proven approaches for executing successfully on big, bold initiatives. So whether you're just starting your journey to high reliability or well on your way, this event has something for everyone. Our time-honored commitment is that every attendee leave with an actionable and impactful plan that they can just start when they get back to the office the next day. The event is on June 18th and 19th. In Madison, Wisconsin, and you can go to capstoneleadership.net and under the resources page, look for the details on our upcoming events. Plan now for you and your executive team to attend.